Uh-oh. So it looks like there's a new virus that has now been found in the United States, or it spread to the United States. It looks like it started in China. It's called the coronavirus. You know, Corona, like the beer. Yes, it's called a coronavirus. That's the name of the virus. It says the United States has its first confirmed case of a new virus that appeared in Wuhan, China, last month. The U.S. Centers of Disease Control and Prevention announced Tuesday the coronavirus has already sickened hundreds and killed 6 people in Asia. CDC officials said the United States will be more strict about health screenings of airplane passengers arriving from Wuhan. The patient, who is not being named, is in isolation at Providence Regional Medical Center in Everett, Washington. He is in his 30s and lives in Snohomish County, Washington, just north of Seattle. He had recently returned from Wuhan. He arrived at Seattle-Tacoma before any health screenings for the Wuhan coronavirus began. He sought medical care on January 19th, which is 4 days after. We believe the risk to the public is low, said John Wiseman, Secretary of Health for the state of Washington. The patient became ill 4 days after arriving in the United States and sought care. Based on the patient's symptoms and travel history, doctors suspected the novel Wuhan coronavirus and sent specimens to the CDC in Atlanta, where tests Monday confirmed the virus. The patient is faring well but is still being kept in isolation out of an abundance of caution, health officials said. So they're going to have more screenings at airports for flights coming from China, I guess, or specifically Wuhan. So it says person-to-person transmission of the Wuhan virus. The Wuhan coronavirus in the same family as severe acute respiratory syndrome, or SARS, which killed more than 700 people in 2002 and 2003, and Middle East respiratory syndrome, or MERS. To date, the Wuhan coronavirus has infected more than 300 people and killed 6 in an outbreak that has struck China, Thailand, South Korea, and Japan, and now the U.S. It's not known how many of the cases became infected from animals and how many from another person. On Tuesday, the CDC activated its emergency response system in response to the Wuhan coronavirus. The CDC activates this system on a temporary basis to centralize how the agency monitors, prepares for, and responds to public health threats. It says the outbreak started in late December at an animal market in Wuhan. About 700 miles south of Beijing, the virus can jump from animals to people. While there's much to learn about how easily the virus can be transmitted human to human, health officials said it appears that it's not spread as easily as some other viruses. Quote, "This isn't anywhere near in the same category as measles or the flu," Dr. Martin Cetrin, director of CDC's Division of Global Migration and Quarantine, told CNN. So, luckily, it's saying that, okay, the spreading rate is not as easy as measles or the flu. So that's good. The thing about these things is a lot of these will have like very similar, it's with all these kinds of viruses and these colds, like there's not really any sort of really key specific sort of symptoms that you could tell automatically, like, oh, this is probably it. It's more of the same shit that happens with the other one, so it's tough to kind of determine which one it is. But hopefully this does not spread. This would be really bad, obviously, and hopefully it just does not spread. Okay, let's hope that is the case.